Hey guys, welcome back to my channel. It's me, the Trendy Nurse, and I'm coming at you today with another nursing school vlog. I'm currently doing a clinical. I'm doing my maternity slash OB slash women's health slash newborn care clinical this week for school. Currently I am in my maternity section of my classes, so typically the clinical is aligned with whatever class you're doing at the moment. So being that I am in my maternity section, I'm currently doing a 3-day clinical at an OBGYN office. So far it is going great. I have been able to assist with a handful of interesting procedures, exams, and come across a lot of very nice people. My preceptor is amazing. And currently I am on my lunch break. Over the past few days, I have wanted to vlog in the morning on my way here to my clinical, but unfortunately it just hasn't worked out that way. The mornings have been a little hectic, making sure that I have everything that I need, making sure that I get out of the house on time, and I also drop 2 of my children off to school in the morning before I head here. So it's just been a lot. But not in a bad way, in a good way. Everything's been going great, and so it's been on my mind to hit the record button as soon as I can, and so here we are today. So I'm on my lunch break, getting ready to head. I think I'm gonna go to Chick-fil-A. There's a Chick-fil-A as well as a handful of good fast food chains nearby on the main street, which isn't far from here. So I'm gonna go ahead and I'm going to head to Chick-fil-A for some lunch, and I also want to go to Dollar Tree because I plan to get my preceptor or the nurse that I'm shadowing, or that I have been shadowing for the past 3 days. I do want to get her a little thank you card because she is wonderful. She is so sweet. So those are the 2 things that I want to do on my break. So I'm gonna head out so that I'll have time to get everything done within my hour. So yes, so I have been doing the clinical for 3 days. The times have been 8:30 to 5:30. I have been shadowing a nurse in an OBGYN clinic. I've been shadowing her as she does her intakes, her health assessments, as she sets up the exam rooms for the different procedures, as she orders tests, as she processes labs. So it has been a wonderful experience. I've gotten to see a lot, I've gotten to assist with a lot, and I've gotten to learn a lot, most importantly. And so it's been a real positive experience. So I was eager to turn the camera on today so that I can get some footage of this because it really was an amazing experience. Some things about the clinical experience. Like I said, I've been going from 8:30 to 5:30. I've been going to an OBGYN clinic. I've been shadowing a nurse during this time, and she has allowed me to do vital signs. She has allowed me to do the health assessment. She has allowed me to I gave an injection earlier today. I gave a tetanus injection or Tdap injection earlier today. She let me lead with assisting the provider with a procedure, which was nerve-wracking. It was an IUD insertion, and she was just there like telling me, okay, hand him this next, do this next. And so it was really nerve-wracking, but that's really the best way to learn, and that's the best way to get the hands-on experience. So I'm really thankful for her as well as the provider for allowing me to help him during this time, and they've all been so amazing. So like I said, I'm headed to Dollar Tree, and I'm going to get her a nice little card. I was thinking of getting something to go along with it from Dollar Tree. I was like, I don't know if I should get a candy or something, but she did tell me that her go-to typically for lunch is Chick-fil-A. So I'm thinking thinking that when I go to Chick-fil-A, I'm going to get her a little gift card to Chick-fil-A. So maybe like that'll be my way of like buying her lunch one day. So I'm thinking that'll be a good idea to do. So I'm here at Dollar Tree. I'm getting ready to run in and get this card for her. And I will be right back. Okay, guys, I'm back. I just got out of Dollar Tree. And I picked up a few things. Of course, you know you can't go in Dollar Tree and just get one thing. But what we came for was thank you cards. So I thought these were cute. And it was a little pack of 6. And I thought it was a good idea to get 6 because I plan to give one to my preceptor Shantae, and I'm also going to give a thank you card to the physician that we've been working with for the past 3 days. Like I said, he's been really wonderful in allowing me to observe and also taking time out to explain things to me. Also taking time out to have like little teachable moments. So they've both been really amazing. So I'm going to give them both one of these little thank you cards. And I thought they were cute because they're not really big. And I know people usually like keep things like this at their desk. So I didn't want to get no big old card that, you know, takes up a bunch of space and she ends up having to put it in her drawer. At least something like this you can like stick on your cubicle area. And with the pack of 6, being that I will have more clinicals down the line, and hopefully I have amazing preceptors and physicians and, you know, staff that are amazing as well. So this is just putting that in the air, you know, positive vibes in the air that I will need these in the future when I go to future clinicals. So if I have 6, then I'll already have them if I need them down the line. While I was in there, I also ended up, very random, picking up these. They are little mini Halloween trees. They're 11 inches tall and they're like black and orange. You can kind of see it there. Little Dollar Tree. Why do I have these? Yes, it is fall, but not really for fall. I got them because my youngest child will be turning 2 on October 26th, and this year we're gonna give her like a costume party. Her dad is like absolutely against her having a Halloween party for her birthday, so we do not say the word Halloween, but it's actually going to be a Mickey Mouse themed, not so scary costume party. So I love a theme, so you know, things that are like layered like that is just right up my alley. So she loves Mickey Mouse. She's a Mickey Mouse Clubhouse junkie, so I thought incorporating the Mickey Mouse with the Halloween, well, you know, with the season and making it a costume party would be really fun. She'll be 2, so I think that it will be perfect. So I was looking for, I'm in the process of looking for little things to fill up the kid table because I plan on getting like one of those small like kid tables that people use now for parties and, you know, decorate it. So I thought that these would be good like little centerpieces because they'll add height. My thing is I just don't want the kid table to just be kind of flat, which it could still be cute with all things that are little, but I just wanted something to add a little height. But I'm not all the way sold on these, really. When I get home, I'm going to take them out and look at them. And so they're really a question mark at this point. But for $1, I said, why not buy a few and just have them? So we'll see. And I do plan to vlog when I do the party for my baby next month. I will vlog that. I love doing parties and balloon decor and all those things, so you guys will see that. But I digress. So next stop, what time is it? Yep, I still have 45 minutes. So next stop, we're going to Chick-fil-A. I'm going to get something to eat, and I'm going to get my preceptor's Chick-fil-A gift card. Pretty sure they sell them at Chick-fil-A. I don't see why they wouldn't, but I'll probably get her like a $10 gift card, enough to, you know, buy like a meal one day for her for lunch. So in this video, I will end up breaking at some point in the video and bringing you guys inside the clinic. Of course, I could not, flat out record or put patient information, or I didn't even feel comfortable really asking my preceptor or anyone to like take pictures with me or anything like that. So I just appropriately took photos and videos of kind of like what the exam room looks like, what some of the instruments, some of the tools and things like that, some of the ultrasound equipment and things like that I thought would be interesting to incorporate in this vlog. So we'll probably go ahead, this will probably be a good time to cut into that, so, or maybe not. Okay, so I'm in line at Chick-fil-A and it's lunchtime, so it's really busy here. So I thought this would be a good time to discuss a few obvious things that I didn't get a chance to yet. Number one is, yes, I'm in all white. Unfortunately, our clinical uniforms or our official uniforms are all white, and it consists of a scrub top, white scrub pants, white leather shoes, and like a white lab jacket, which you really don't have to wear at all times, but I tend to like to carry it with me, and most of the time I have it on because typically when you're in a hospital or a clinic somewhere, usually it's kind of cold, so usually I am in my lab jacket. So I will input a picture of what the uniform looks like here, somewhere about here. So whenever we go to clinical sites, this is what we are required to wear. When I am in the classroom, just a regular classroom day, then you can wear whatever type of scrubs you want. So I don't have to wear all white every day, but it's a little nerve-wracking whenever you do have to wear it because you're still in a clinic, you're dealing with materials, you are assisting with procedures and things like that. You still have to eat, you still have to have breakfast, you still have to have lunch, and so it's like your anxieties are like, oh my goodness, I don't want to get a stain on me because you're in bright white and any little thing will show up on it. But yes, so this is what I did have to wear for the last 3 days. And yes, when you do wear it, you stick out like a sore thumb because no one in the real world is walking around in all white anymore, so everyone automatically knows you're a student. Which, like I said, there's the good and the bad. In the past, when I have had my clinical uniform on, I have people who are nurses who come up to me and are like, oh, you're in school, and they give words of encouragement or, give advice and, give you little jewels. So it's good because people do gravitate towards you, and most of the time it's with good energy. Usually, whether they're congratulating you on accomplishing a goal or giving you some insight as far as their career and different things that they've learned along the way. So usually it's nice, but I'm not that sociable that much of a social person, so sometimes I'm drained because typically clinic days are like long days where you have to get up early, you have to be somewhere, you're up, you're on your feet. When I get out of here, I get my kids, then I start my home life. So typically clinical weeks are long weeks, so especially if it's later in the week, I'm usually tired. And so for people to just come up and want to conversate for 5 or 10 minutes, sometimes I'm just like, thank you, but I'm just so tired. But ultimately though, it's a good thing, and it's nerve-wracking, but hey, it is what it is. It's something that really has not changed. I do see at some schools, people may have like blue or red or navy scrub pants, but for the most part, the tops for nursing school students are still white, and typically they'll have an emblem on them. Like mine has an emblem right here, And on my sleeve, which I'm actually gonna get ready to take this jacket off to eat, but on my sleeve it has like a blue stripe on it as well, but otherwise it's all white. Hi, how are you? Good. I wanted to see if I can get a gift card. $10. Okay. Okay. Number 3, okay. Oh my goodness. I just want my food. Alright, so now I'm waiting for them to bring my food to me. But in the meantime, I was able to get my Chick-fil-A gift card for my preceptor. So here it is, cute little gift card. I put $10 on it. Like I said, it's enough to buy our lunch one day. Typically these meals here are about $8 or $9. So with tax, I'll be able to get our lunch. So guys, I'm just really across the street from the site that I'm at. So I'm just waiting for my food to come out. Once my food comes out, I'm just gonna eat and then head back in. So now would be a good time to actually take you guys in with me. So I'm gonna go ahead and insert some clips and videos of just different interesting things that... Yes. All right, thank you. As I was saying, just some interesting videos and clips of the office and some of the basic procedures that are done and some of the equipment that's used and anything that I thought would be good to put in this vlog. So we're about to go back in. Well, I'm about to go back in, so I'm taking you in with me. And then I'll be back on my way home. We'll recap, you know, the experience in the day. So I hope you enjoyed the videos and the little clip that I put together, and I'll see you guys back in a bit. guys, welcome back to my channel. So I am, well, it's 5 o'clock right now, so I just ended my day. The afternoon went well, and I hope you guys enjoyed the videos and pictures and clips of different things that I inserted into the video, just to give you an idea of what the clinic was like, some of the instruments and different type of tools, and the way the rooms were set up. So I hope that you guys found that interesting and informative, as far as maybe what to expect in an OBGYN office. So the end of the day, the afternoon was kind of slow for the provider that I was working with. She had a few no-shows, meaning patients that didn't show up to their appointment. So there was a lot of downtime, but like I said, my preceptor, she was amazing. So during that time, we, talked about different things in regards to nursing and nursing school and overall all things nursing. So we did utilize the time to discuss things, and she did give me some good advice and a few good gems. So I really appreciated that. And I did give her thank you card with the Chick-fil-A gift card inside of it, and she was really excited. She said it was so thoughtful, and she really wasn't expecting that. So I was happy to make her smile, because like I said, she really was great, and I feel like she really deserved that. So now I am on my way home. I have about a 20 to 30 minute ride to get to home. Well, not really home right now. I'm headed to pick up 2 of my children. One is in daycare and one is at an after-school program. But first, I have to get some gas. So I'm going to stop and get gas first really quickly, and then I'll be headed to pick them up from school for the day. From there, I'm going to go home, probably make dinner, relax for a little while, and then I'll begin working on my coursework that I have to do for the week. I do have a case study and a concept map to do for the week. So I'm gonna get some gas, and then I'll come back and discuss the work that is typically associated with the clinical day, what type of school or homework that I have to do typically on the nights that I do go to clinical, because there is still school work on these days. So I'll be right back after I get some gas, and we'll go into that. Okay guys, so I just wanted to get a drink in so I don't sound dry. So I just finished getting gas. So now I'm on my way to my next destination to pick up my kids. So where we left off was going over the daily homework that I have, or the daily assignments that I have on clinical days. There are 2, it's pretty much consists of 2 that we do daily. The first one is a discussion board, in which we will go on Blackboard, which is the software that my school uses, for assignments and, for classes, the virtual space that we use to upload assignments and everything. So we'll go onto Blackboard, and you post a discussion every day about your day, in which you're expected to post something interesting about your day, something you may have found challenging, something that worked in your favor, something that may have not, pretty much anything that you want to write about your day. It's really not set in stone as far as what you can and cannot put on there. And so you do that, and then you have to read and respond to at least 2 other classmates' discussion posts for the day. So a lot of times, a lot of my classmates do their discussion boards during the day. We try to get them done kind of during lunchtime, or if you have downtime during your clinical. That way, when everyone gets home for the evening, all we have to do is really read and respond to whoever post that you're going to respond to. So that's one of the assignments that we do every day. The second assignment that we do every day is a nursing care plan. What we have to do is choose a patient and create, well, a patient from your clinic or hospital or nursing home, wherever you were for that day. You choose a patient and you choose one of their symptoms of their medical diagnosis, and you create a nursing care plan. And generally what a nursing care plan consists of is you're doing this, you have your nursing assessment, because that's first with everything. When it comes to nursing, assessment is always first. So you document your assessment of the patient, and which will include signs and symptoms of the medical issue. From there, you identify what the problem is, in which we call a nursing diagnosis, and that's pretty much what you're going to be trying to help them with. If it's a symptom like nausea, vomiting, a headache, or pain, or something like that, then from there your intervention will be how you're going to help alleviate, or help to relieve that symptom. And then from there, you have your evaluation. You evaluate your intervention. So whatever you did to help that patient, from there you have to follow up in a timely manner to determine if it helped or not. Did it help? If it helped, great. If it didn't, then you start over. You do your assessment again, identify your intervention, and evaluate your outcome. So generally, we do not obviously use real patient names or identifiers. You pretty much just, identify a patient who has, generally, I would always advise you would want to identify a patient who has signs and symptoms or a diagnosis of something that is actually interesting to you, because that is really going to make doing your nursing care plan a lot easier. If it's something that's actually interesting to you, you'll be interested in actually coming up with nursing interventions and writing your evaluations and outcomes. So pretty much you choose a patient, and typically our instructors require us to have 2 psychosocial and 2 physiological nursing diagnosis for each patient. Psychosocial are diagnoses that pretty much affect your mental or your social interaction with the world. So things like anxiety, diagnosis like depression, what else? Deficient knowledge, things like that, that can affect or really are coming from a person's mental are what the psychosocial diagnosis are. And then your physiological diagnosis are things that are actually affecting the patient's physiological integrity, their body. Things like acute pain, headache, nausea, fatigue, vomiting, weakness, constipation, diarrhea. All of those things are examples of physiological diagnosis. So typically we do 2 of each, and you identify at least 2 interventions for each, and then you do 2 evaluations for each. We've been doing this now since about March, and we're at the end of September, so I've been doing them now for about 6 months or so. So I would say, especially if I have one that's interesting, it would take me about 30 to 45 minutes to do my nurse care plan in the evening. Now, when I first started, obviously it took me about 90 minutes, about double the time, to do each one in the evening. But as time has gone by and I've gotten more used to doing them, I actually am able to do them a little faster, because I know what type of information I need to document and I do that, and I'm more confident in doing it. Initially, you're kind of nervous. You don't know if you're doing it right. You want to make sure it's perfect. You don't want to get a bad grade. So typically you second guess yourself. You're double checking and you're triple checking, and so it can actually take 90 minutes to 2 hours to do a nurse care plan at the beginning of nursing school. So those are really the two things that we are expected to do every night on days that we go to clinical. On days that we don't go to clinical, it's not required. But these past 3 days, I have had to go home every evening and do a discussion board post, respond to 2 of my classmates' discussion board posts, and create a care plan, an OBGYN-based care plan. Because it's going to be based on a problem that someone would be coming into the clinic that you are in. So if I'm in the OBGYN clinic, it will obviously be something OBGYN related. Besides that, this evening, I will also be studying. I do have an exam on Monday morning. Our first OBGYN/maternity exam is this Monday morning on the first 5 chapters of the subjects. So I will begin studying because it is Thursday evening, and I have started studying a little each night, about 30 minutes or so, but not too much, because I just kind of wanted to make sure I was well rested for clinical. But now that I'm done with clinical, my next priority is doing well on this exam. So tonight I will spend about an hour and a half or so making sure that I have the right flashcards and that I have all the right notes on the key points and key definitions that I need for my exam on Monday. So that will be my evening. I'll make dinner when I get home, and I'll get my kids settled, and I'll most likely be doing the assignments as well as studying. I'll probably go from between like 9 o'clock to 11 o'clock. That work. It sounds like it will probably be about the times that I'm doing those things. So that will round out my clinical day. So guys, I thank you so much for checking this video out. If you guys have any questions on anything, any advice or any requests on videos that you'll like me to upload, or any specific content you'll like me to put on this channel, please be sure to write it in the comments. I will definitely read the comments and try to respond as quickly as I can. If you like this video, I would appreciate a like. If you like my vibe, I would appreciate a subscribe. Either way, I do appreciate you being here, checking out this video. I hope it was informative to you, and I hope that it was entertaining as well. Until next time, peace.